Good
Hi, everyone.
evening.
So my name is Ryan Spencer. I am one of the board members here at Hacknight, and I'll also be your co-host for this evening alongside with.
My name is Miyako Furuhashi. I'm a co-host tonight.
And we're really excited to welcome both Laura Michalski, if I said that correctly, and Carrie O'Brien with the Northside Housing and Supportive Services, who will be doing a presentation with us here later on. But before we get to that, we just want to go through a few housekeeping items.
Okay.
We're going to switch slides here in just a second.
Working on it.
No problem. We'll take a few moments, just chill out for a second. This is the very last Hacknight of 2020. This is a big deal, so we're in no rush.
Yes, and this is Hack Night 425 tonight. We had 425 Hack Night. It's a great milestone for us.
And if you have time over the holiday break, feel free to watch them all on YouTube. Okay, so the way this event works is that we're going to start, of course, with our live stream. So we're going to go through some welcome and some announcements. We'll then have our presenters do their presentation, and then we'll also have a Q&A afterwards, so you can ask a few questions. And then following that, there will be a post-Zoom call where we're going to go through some introductions and do community announcements, and of course, the civic hacking portion of the evening with our breakout group. So that is our agenda for this evening.
Yep, and we hope you stay around after this. And our we're going to have Q&A after the presentation, and you can ask questions through YouTube chat, and we will have the presenters' answers for us. So let's go on to the announcement section.
Okay, I'll take the first one. So if you have not already done so, please join the Hacknight Slack channel. This is a really great way to stay connected to everyone in the community. You can introduce yourself, and it's also a really great resource for jobs and just interesting questions. So if you're looking for a way to kind of stay connected virtually, the Hacknight Slack channel is a great way to do that.
So this is the last of the year. And we will have a break on December 22nd and December 29th. We will not have any presentation or events. I'm sorry. I know we'll miss you. And our first of 2021 will be January 5th. We'll come back more fun presentations and civic hacking.
Mark your calendars, folks. Okay, so become a Hacknight member. So I'm a Hacknight member. I'm sure Miyako's a Hacknight member as well, but we are a membership-based nonprofit. So what does that mean? That means you can do things like run for office, vote for changes in our policies and bylaws, and also just make decisions on what Hacknight does. So if you're interested in becoming a member with us and joining our community, we do have a link that you can follow that allows you to apply for membership. So become a member.
Please do. I just applied last week, so everybody should do it too. So we have a help desk. If you can offer your help, tech, and data, please sign up at bit.ly chn-help-desk-volunteer. You can either get your help or you can offer your help. Thank you.
And then, like I said before, we will have that post-presentation Zoom call. So just follow that link. That link is also going to be on the Hacknight Slack channel as well. That's going to start at 8 p.m. and we're just going to do some announcements, get to know each other a little bit better on Zoom, turn on our camera so we can all see each other's faces, and then also just have, a quick discussion in breakout groups. Okay, so I think that may be our last announcement. So without further ado, it's time for our wonderful guest to start the presentation. So Miyako and I are going to turn off our cameras, but please give a warm welcome to Laura and Carrie.
Okay, so let me introduce myself. My name is Laura Michalski. I am the Executive Director here at Northside Housing and Supportive Services. I'm just going to give you a little bit about my background. I joined the agency about 8 months ago, right when the pandemic started. And so my background is in public health. So I have a little bit different kind of perspective on homeless services and the services that we provide. I originally have come from a community health center. My last position was running a homeless healthcare agency in Salt Lake City, Utah, and just recently left and came back to Chicago. So I think kind of falling into homeless services amidst a pandemic has been a good fit for the agency. I am also joined today with Carrie O'Brien. Carrie, if you want to introduce yourself.
Hi, good evening. My name is Carrie O'Brien, and I am the Development and Communications Manager at Northside Housing. And I also joined Northside Housing this past spring, just shortly after Laura. I've been working in nonprofit marketing, communications, and development for nearly 10 years now. Previously, I worked in mental health. So I think it all ties together, and I'm just really excited to be part of this team. Thank you.
Thanks. Well, both of us are very excited to be here tonight, and we appreciate the opportunity just to talk to you and share some of the things that are going on in homeless services, some specific to the city, others specific to our agency. We're going to provide some background just on Northside and the services that we provide, then some information about the homeless population that we're serving and the implications of COVID and what it's done to our agency and the homeless population as a whole. What Northside Housing is we're a comprehensive homeless service provider. We provide a lot of different services, which I'm going to get into, but we've been providing services since 1983. We started as a homeless shelter in the Lakeview area, and it was a combination of your kind of typical grassroots effort of a church basement where individuals can come and spend some time if they're experiencing homelessness. It really kind of grew from there into the comprehensive agency that it is now because of the specific needs of this population. Serving individuals that happen to be experiencing homelessness is a complicated service, and the needs are so vast and so different for each individual that we see. So we really wanted to develop more of our programs geared at meeting the individuals where they're at. So what we did was we developed 5 different service lines. The first is we're continuing with our emergency shelter. Our emergency shelter is for men only, and it's in the Uptown area. We provide 24 hours a day, 7 days a week. Individuals can be referred to us to come and stay. Right now, our capacity is a little bit less than what we normally have because of decompression, and I'll talk a little bit about that, but our normal capacity is 72 men per night. And then what we can do there is we provide a warm place for them to stay, showers, laundry facilities. We have 3 meals a day. They can access comprehensive intensive case management. They can be referred for housing. They can work with a case manager on employment skills, filling out a variety of different public entitlement forms if it's appropriate. So they really do have that wraparound services that individuals experiencing homelessness need in order to move forward. Last year, we were able to successfully move into permanent supportive housing at least 40% of our clients. So annually, we see about 300 people coming through the shelter. So we're pretty successful in that area. The other area is permanent supportive housing, which is kind of like our second area that we focus heavily on. We have about 198 apartments throughout the city. These apartments are community-based, and individuals kind of get to pick where they live. It's somewhat similar to a scattered site model. We don't own the apartments, but individuals go out and we work with them through intensive case management to locate these different apartments. And we work with them in a way to make sure that they can stay housed. So we've been pretty successful in this area. The average kind of length of stay in permanent supportive housing for our clients is 4.5 years. That's actually really well for this group. And, you know, we continue to look for areas that we can improve on, but really the housing market in Chicago is pretty limited, at least when it comes to affordable housing. So we really kind of focus in 21 different kind of neighborhoods throughout the city. The next area is our day support services. Our day support is in our main Ravenswood location office, where individuals can come in, they don't need an appointment, and they can drop in individuals that are on the verge of homelessness or currently experiencing homelessness. They can meet with a case manager, they can get referrals, they can do a screening to see where they would fit on the housing need list. They can access a food pantry, clothing closet, work with the case manager on employment opportunities, enrollment programs, a variety of different other services that you would see throughout our kind of platform of services here. Each year we service about 200 individuals through that program. Our newest program is our Housing Navigator program. This started last year, and what it is we take referrals for those who are eligible for permanent supportive housing, and we connect them with a navigator to go out into the community to locate housing. And then once they secure housing, then we kind of release them and pair them up with their appropriate case manager. So that has been pretty successful, and I'm going to talk about that a little bit later on when we specifically talk about COVID. Then our last one is our integrated health program. I'm not sure if you can see that or not, but this is a service that we've been providing for a number of years. It's really focused on our permanent supportive housing program. It is a nurse who goes out into the community as a nurse care manager who works individually with clients on their health needs, advocates, does a lot of education. She works with them to connect them to their appropriate services. I think we all know that the healthcare system is a little complicated. And so if you have specific needs, it could be a little daunting to figure those out on your own. So our nurse care manager works with them and helps them achieve their own personal health goals. All of this is kind of linked together with intensive case management. I think this is why our programs are successful, and we can move people into more sustainable housing programs and into kind of this road to recovery. So this is kind of the beginning of our services, so you understand what we do, who we are and what we do. We are predominantly a male population, especially at our shelter. It's 100% male, but within permanent supportive housing, we are predominantly male, but we do have females throughout that program. 99% of our population is single, which gives us a little bit more flexibility, but then you can understand the base that we're starting with. Age range is typical for the typical individual experiencing homelessness. Then 46% meet the HUD definition of chronically homeless. And that definition is somewhat of a complicated definition. It's not just that you're without a home. HUD requires you to have a disability and you've been homeless for 12 months in a place that is unfit for human living. And that does not include couch surfing or staying with friends or family. Then if you don't have the 12 months, they look at a 3-year period and you have to have been homeless at least 4 times during that period. And so HUD doesn't make it always easy to be homeless to meet these definitions for programs and services, but you can look at our numbers and see that we're still almost 50% of our clients are meeting that definition. 40% of our clients are not in the labor force. They're collecting, whether it's Social Security or some type of disability pay. 70% of our clients are African American. 41% have a mental health issue. And I kind of score this as it's based on a self-reported assessment. And we know that this is significantly underreported. So that's something to take into mind. Individuals not always acknowledging their mental health issues. Also with that does include substance use disorder. 68% are disabled and 10% are veterans. Each year we service just over 700 individuals through all of our programs. So COVID hit, and one of the things that is really important to recognize with this population is housing is healthcare. And that isn't always necessarily easy to think about, but in terms of COVID, it made it very clear. We were told to shelter in place, and when you're homeless, you don't have a place to shelter. You know, when you start thinking about where you are recovering, and if you were feeling ill, laying on the streets or in a congregate setting sometimes isn't always the best. You know, when you think about balancing, you know, taking medications that may have some side effects, you know, you want to be someplace where you can lay and rest and recover. So we equate housing as the first step in healthcare and making sure that people are able to find some place to rest and recover. With the homeless population, if you're not out on the street, typically you're in a congregate setting. And a congregate setting is your shelters. And as probably everyone remembers from the news, that was probably the number one concern, is now you have what we did, 72 men in one room who could potentially be spreading COVID. They are already at risk for other respiratory diseases, TB, pneumonia, things like that. That has always been one of the issues associated with congregate setting. So also with the homeless population, these are things that are generally already happening. So it's magnified when COVID-19 happened. Homelessness is also the greatest health disparity out there right now. So there's been a lot of conversations, and that's probably one of the new buzz terms is healthcare disparities, but it is very true for this population. And for so many different reasons, you don't have access to food and shelter the way that you normally would. We know that homeless individuals experiencing homelessness have poor nutrition, poor hygiene. They have higher stress in their lives. They aren't able to rest on a consistent, regular basis the way that you or I would. And these are everything that our public health officials are telling us to do to stay healthy, is to eat right, make sure you rest, get your exercise, make sure you're not overweight, make sure that you are taking care of yourself. And this population is not able to do that. So we knew going into COVID, this was a great risk for this population. We also know that chronic disease is exacerbated 3 to 6 times more than in our housed population. And the next slide, I want to just show you this. This was interesting to look at. So we know that diabetes is one of the new things that everyone seems to be tracking or has been, but you can see clearly it is almost twice as much more prevalent within the homeless population because they're not able to eat the appropriate foods, not able to take their medications the way they should. Hypertension, heart attacks, HIV, it's unacceptable. Hepatitis C, those are things that are going to impact your overall health. And then if you get sick with COVID. So we see these things kind of very clearly. You can see that it is a risk factor to be homeless. The substance use disorder is outrageous. We know that individuals are using, and this is going to come up in a story that I have for you, but depression, looking at the overall average age of death for individuals experiencing homelessness is easily 20 years less than the housed population. You can look at different resources around that, but it is significant. Today happens to be the 30th anniversary for the Homeless Memorial, and it's going on tonight. It's remembering those who have passed away on the street, who have been homeless or recently homeless. And each year that number continues to increase. And this is something that we have to take seriously. I don't know what it's going to look like next year because of everything associated with COVID. We know already that it has impacted our agency. And I'm going to talk more about that. But kind of a snapshot of what the city did in order to respond to this. Hotel 166 was in the news. It was a hotel location where we can move individuals who were in a congregate setting that were over the age of 65 or 50 with an underlying health condition. So they were able to move in there. We were able to bring in our housing navigator to help locate permanent supportive housing for these individuals. We actually located within a 2-month period housing for 15 individuals, which was great. We moved them out of shelter. We moved them into their own home, which was great. Unfortunately, housing or Hotel 166 closed in September. So then we came back to, what do we do for this population? Where do they go? What needs to happen? Where are individuals going who are COVID positive? One thing that I do want to mention is, for us as an agency, we only had 2 cases of COVID within our shelter and an additional 5 in a permanent supportive housing, which was a great kind of low positivity rate compared to some of the other shelters out there. But this doesn't change for that individual who is experiencing symptoms. Where do they go? The city has dedicated 2 sites, a safe haven, which is kind of on the near west side off of Roosevelt, and the South Side YMCA, which is on the south side, where individuals can go and stay in isolation while they're experiencing COVID or COVID-like symptoms. One of the things that we did, keeping in mind all of this is going around, what homeless service providers are thinking is, they're not in the healthcare field. They're reacting. They're reacting to everything that is coming at them. What do? They want to assist their clients. They want to make sure that they're staying safe. And, most of the homeless service providers are HUD funded, which is, one branch of the federal government. They're not getting the money the way that the healthcare system is, like through HRSA. And there are 2 different branches of government that have completely 2 different philosophies on how they share information and get funding out to community partners, but yet they're under the same umbrella. It was just interesting to see this in real life. So as a service provider, you start talking to your neighbors and saying, what are you doing? And what's going on here? And that's really how communication started. And so one of the things that we did with several of our Northside community partners was to talk about, how are you responding to COVID? What are you doing for your clients? Are you getting information from the city? How are you getting your clients to Hotel 166? And so this really kind of gave birth to something that we call the Northside Shelter COVID Response Group, where we came together. At first, it was on a daily basis saying, what are we doing? How are we doing things? And sharing information, which was great. It really provided an opportunity to really solidify some of these community partnerships a little bit more than what we had before, but then to learn from each other. At that same time, the Chicago Homelessness Health Resource Group for Equity was another group that was happening a little bit more in the downtown location. And so we had members of the Northside group and then the downtown group kind of collaborating and sharing and spreading information. The response group downtown really had a lot of powerful people behind them. So they were able to get more resources and then extend it out to some of the smaller service providers. But these are things that were really helping our clients in a time that was so uncertain, because the things that we didn't know, I think we learned a lot when the H1N1 virus was here in Chicago, and we kind of lived through that and learned some things, but it was never at the magnitude of COVID. So we shared more information. Then the program, which is called Expedited Housing Initiative, came up where we wanted to move individuals into housing a lot quicker than what we had been, which is wonderful.
Please, I will let you know.
So that program was going on, and it's fantastic. It's bringing landlords together to figure out what housing is available for this population. I think the unfortunate thing is it took a a pandemic to move this forward. So we're hoping that this continues even post like vaccine and post pandemic, is we really need this housing for this population. And I think that's probably one of the biggest criticisms that you'll hear from the community is, why did it take a pandemic to make this happen? Well, at this point, we're taking advantage of it and we're trying to move people into expedited housing as soon as possible so that they can stay safe. Another initiative that was started was shelter-based care. Shelter-based care was a concept that's been around for a while, but now that there was some funding behind it, was to bring more care into the shelters. This was something that has been done previously, and then it fell by the wayside. Not really sure why or how. Maybe it was just kind of a sense of complacency, but we're bringing it back where the healthcare providers are coming into the shelter. This was something that we started with this Northside Shelter COVID response group, just because our clients weren't going out. They were staying in shelter 24/7, but we needed healthcare providers to come in. So the shelter-based care was really a great response. And this is something that the city is helping to support. How long? We're not sure. Hopefully a lot longer than what it had been before. So that's kind of like the city's approach. Now, Northside was in a little bit different situation. I talked a little bit about kind of like how this came on so quickly. Northside Housing is a housing program. It is not a healthcare program. We have a component of health, but it's still a housing program. So when COVID hit, we needed to respond quickly and develop and implement a COVID-19 infection and management plan. We knew about infection, but we didn't know at the level and the severity of how COVID was going to go through our system. So looking at the latest things that were coming out, trying to get our hands on literally hand sanitizer. We ended up getting some from a local distillery. We needed this. Our shelter was first responders. We needed this to happen. We needed to figure out how we were going to screen people. As they're coming in, we needed to decompress our shelter. We are now down to a max capacity of 40, from 72 down to 40. This forced us to leave some additional space so we can even maintain those 40 beds for individuals. Cleaning, the cleaning supplies, hand sanitizer, PPE, the personal protective equipment, everything that you think of you personally is now magnified for our shelter. Then we think about what's happening in our permanent supportive housing is, do people have the ability to make sure that their personal environments are clean? They have their own apartment, but how do you respond to that? How do you make sure that you have the cleaning supplies or the masks as you were going out? So we need to make sure that we secured masks. We had volunteers sewing and making homemade masks that we can distribute to our clients in shelter, to distribute to our decisive program, that if individuals were coming in and needing stuff, that we were able to dispense that to them. In our permanent supportive housing, and to make sure that our staff was staying safe at the same time when there are already such limited resources. We depended on, donations. We needed to figure out how we can get the right equipment in people's hands. So we decompressed our shelter. We started doing in-person screening and testing just as everybody else was doing. We started partnering with Chicago Department of Public Health. We partnered with Heartland Alliance, which is a community health center here in Chicago, and they were able to come into our shelter. Our nurse kind of transitioned out of the permanent supportive housing realm into the shelter to help kind of facilitate some of this that was going on and to answer questions of staff. Now, keeping in mind, our staff is lay staff. They're not healthcare staff that are now suddenly having to ask questions of clients coming in, taking temperatures. They were able to do that. They were phenomenal. I just want to say that. They did a great job in doing that. Then we were recently, through a partnership with Heartland, able to bring on-site rapid testing for our clients. So as they come in, we are able to screen. Keeping in mind that that doesn't mean if someone goes outside, they're not bringing the virus back in. One thing we did notice was with our shelter staff, we had a higher rate of positivity with our staff because they were going home and into the communities where they were living, could be taking public transportation or whatever it may be. So they were actually the person who potentially could be bringing COVID back into the shelter. The same thing with the interactions with our clients for permanent supportive housing. So we really needed to make sure that we were doing everything possible to keep them safe. We restricted in-person client contact. So meaning for permanent supportive housing, if you were meeting with your client on a weekly basis, now you had to do it through the phone or do it through email. And that really was difficult for us to manage. We have a drop-in center that you can't drop in. You would have to phone. And so when you're experiencing homelessness, you don't always have access to a phone or a charger to charge your phone. So this really became a problem for us in trying to figure out how do we still serve the population that we are dedicated to serving. We had to move to a remote work environment. And I think all of us know that. As I sit here at my dining room table, we know that working from home is problematic because our staff is dedicated to serving this population. And so many of them felt very, uneasy knowing that their clients are out there and they're not able to go and see them. So this really kind of created some problems. We were able to put together some COVID care kits. So staff could interact with clients limited. Clients could actually get stuff so they can go out and get groceries. It was a fast and furious response to it. And so overall, I think that Northside and the team there really handled it very well. And one thing that I just wanted to show here, and just a kind of a quick comment, because there were a lot of other mitigating factors going on at this point, is March, we had our shutdown. We had our first kind of social unrest event in May. Then we had another one in June. We are a direct service provider. And so knowing where our clients live, which was often in some of these communities that had the social unrest that prevented them from going out and accessing groceries or needed medications, really kind of hampered our ability to deliver care to them and services. So it wasn't just COVID. Now you had this other thing going on, and we needed to be able to respond to that. We reopened in July. And we were one of the first homeless service providers, aside from shelter, that reopened. We had limited days, but we reopened because of this commitment. And we wanted to make sure that we were there for the clients that we were serving. And we got a lot of feedback from our clients because we were constantly reaching out to them and asking them what they need. They lacked this personal interaction. Then we were prepared for the election that there might be some more social unrest. And we were relieved that they weren't, but then we got another stay-at-home advisory. Our shelter remains open, but now our staff is back at home again. And so really, really kind of seeing how this kind of cycle from COVID and other events are impacting the direct access that we have to our clients, which is so much needed, has really had an impact on our clients. I'm just going to share some of those kind of probably known and unintentional impacts. We lost clients, not just due to passing away. We did lose a total of 6 clients during a 2-month period, which was much larger than what we have ever had. We don't have access to medical reports, so we're not sure if it was COVID related or not, but it also had to do with a sense of isolation, which is another point that when you're forced to stay at home, many of our clients who have a substance use problem or a mental health issue kind of get lost in that lack of social contact, lack of that support system. And so we did see some things starting to happen. And at first, you're focused on the virus, but then you've got to shift. And we had daily calls to some of our clients just to check in and make sure that they are feeling safe, not necessarily from COVID, but, a demon of past substance use or mental health issues. And so really focusing on that and making sure that we can meet and connect with the individuals to ensure that they're getting the services that they need. So we did lose clients physically, but then also because part of working with this population is building that trust. I need to be able to see you. I need to be able to connect to you. Since we weren't able to do that, we lost individuals that we could have potentially helped. And so really trying to come back from that is going to be a struggle for us. I think it's going to be a struggle for a lot of social service providers. Our clients lost employment. Not all of our clients were unemployed. They were the direct service providers at grocery stores, at restaurants, construction, all of that. When everything shut down, they were the first to lose their jobs. So now they're back in the same situation that they were able to pull themselves out of. So they're losing employment. We needed to pivot our program just to figure out how we can start meeting the needs of these clients. So that social isolation, if we're not open, how are we going to connect with you? It's great that we can connect through Zoom today, but not all of our clients have that capability. They may not even have a smartphone. I know in this day and age, it's shocking, but some of them don't. Some of them don't even have a phone. So understanding how you're going to maintain that relationship with them, we were thinking about how we can go back into some of these communities, making sure that staff are feeling safe going there to figure out how we can reconnect with clients. Something that happened throughout the city of Chicago in July, I got a notice from the city indicating that for the first half of the year, there was a 60% increase in overdoses throughout the city. This was one of those unintended consequences that we were thinking could potentially happen for us as a whole, is individuals being isolated, individuals not accessing their normal medications that they might be self-medicating. They might be they were clean and sober for a number of years, and now they've started reusing. These are serious consequences. We had to change this conversation that we're having with staff about substance use and the use of Narcan. This has now become like normal conversation for us, and making sure that people know it's safe and there's no judgment associated with how we talk about substance use, and making sure that we are making individuals know that there's resources out there, and if you're going to use safely. I want to say the past 3 months, our staff actually had to Narcan 2 clients who OD'd right with them. And so that was something that when you're thinking about how you onboard and how you train your staff and the things that they're going to start seeing, this was something that we hadn't really had that much training for lay staff about the use of Narcan. And so that was something that came up as well. Obviously, there was, changing in expenses. We lost all of our volunteers for the most part, unless you were able to do something remotely. We couldn't have people coming into our shelter and volunteer the way that we did before, and figuring out how we're going to, meet those gaps. There was some nice funding that came out associated with COVID, and I'm not going to lie, there was some good resources out there, but it really wasn't long-standing. It really didn't help us meet those additional expenses, both the cash and the volunteer hours that we were losing as an agency, and to pick up those needs that our clients needed. I think Carrie's going to talk a little bit about our client assistance fund, but this was something that we now have tripled in size because of the needs with this community. Overall, we have, I've talked a lot about the communication challenges, both internally and with our clients, on the best way to communicate. But there are some good things that we were able to walk away with, is these stronger partnerships. And hopefully this stuff will continue. I am hopeful on that. At least we can still engage in conversation about expedited housing, about a relationship with Heartland Alliance for healthcare. You know, these are things that we really need. The final kind of one of the other impacts that I wanted to just mention is, you know, it does take a toll on your staff. I think Northside has been very successful in working with their clients, getting them out of shelter and getting them housed, helping them navigate the system out there and finding the resources to work with them. But it does take a toll on the staff. I'm not gonna lie, it's been really hard for staff to make sure that they're taking care of themselves while taking, you know, supporting their clients. And that is a concern, you know, because our program is only as good as our frontline staff. So to make sure that they have the resources that are available during this time as well. Looking forward, I know that there's been a lot of conversation out there about the vaccine and what's going to happen with vaccinations and, you know, all of this kind of angst about it. You know, we're anxiously awaiting. I'm not sure how people are feeling about it, but we're also engaging in these conversations about, is it going to be required? Is it going to be mandatory? What are the side effects? You know, has it really been tested thoroughly? Are people feeling like a guinea pig? You know, there was something, it was probably about the start of flu season. We were talking with another service provider and, you know, making sure that staff get their flu shots. It isn't mandatory, but it was really trying to understand, you know, my background is public health, so why wouldn't you? And just to hear some of the reasoning that is coming up and to make sure that, you know, there's education out there, but to also acknowledge their fears and their concerns over it. And it's not just, well, you have to take a vaccine. And so I think as we move forward with the vaccines that are coming out even this week, how do we respond to our clients that have those equal, you know, important concerns about taking the vaccine? You know, we also have right now going on is the mask fatigue. Everyone is tired of wearing a mask, and there's tons of concerns about people, especially in the shelter, about being lax and not wearing a mask. One of the, I think probably the most inspiring thing that I saw was the clients at our emergency shelter were holding each other accountable for wearing their masks, you know, and not taking it off and not wearing it below their nose and wearing it properly. The shelter really has some great advantages over our permanent supportive housing, and you see these differences. One is there's a community setting within the homeless shelter, which is pretty phenomenal, is how they care for each other in this environment. And then you have the permanent supportive housing program where people feel isolated. And so I think it's just balancing those two and figuring out how we can find the strengths in both areas. But the mask fatigue is huge. Expedited housing, we really want to continue that program with the city and with all Chicago and our community partners, is to get these people housed, get them housed in a way that they feel safe and secure. Funding is going to be an ongoing issue, but stabilizing after this year, you know, prior to the presentation, we were talking about, 2020, thank goodness it's almost over. You know, you were thinking about your goals for this year and how everything had to change in response to the COVID pandemic. But how do we restabilize and refocus and reconnect with everyone to fulfill our mission as an agency? And we know that with job loss and everything else that's going on right now, that there's probably going to be an increase for services, the demand for us. And how do we meet that demand and still continue to take care of our clients? So that's what we're looking at for the upcoming year, is how do we respond to this after we've had already like 8 months of pure intense work that we've been doing. If there's a magic answer for that, I'd love to hear it, but we're still looking at that. Carrie, do you want to talk a little bit about this?
Sure. So volunteering. Volunteering with any nonprofit organization right now has been very challenging during COVID-19, as I'm sure some of you may have experienced. In the past, as Laura mentioned, we've had volunteers come into the office and help us in the donation room, help us with office work. We've had volunteers visit the shelter and spend time with clients, help with shelter work such as meal preparation. These types of opportunities are unfortunately suspended during COVID-19, and it's for the safety and well-being of everyone. But we do have other safe ways to volunteer for Northside. Our shelter can always use donated meals that can be safely dropped off or delivered. We're always interested in connecting with individuals who have professional skills they'd be interested in donating, such as grant writing, graphic design, web design, social media, and fundraising support. And in fact, this coming spring, we're planning on reintroducing our associate board. The associate board will focus on assisting with our communications, fundraising, and donor engagement for Northside Housing. And having this team rally behind these efforts will be a great way to grow our reach, increase awareness, and continue building opportunities for the community to support Northside Housing. If this is something you or anyone you know might be interested in learning more about, please visit our website at northsidehousing.org, or you can contact me or Laura. Our contact information is right here, and we can drop it into the YouTube chat. Now, in addition to volunteering remotely, truthfully, the most flexible way to help support our agency's work is with donations. Some of you may have also found that making donations to local organizations is also difficult right now, that they're unable to accept in-kind donations because of the closing of their offices and things of that nature. We do have limitations to our in-kind donations as well, but we are being flexible and do accept coordinated donations that can be beneficial to our participants, especially with the cold winter months, such as coats, more PPE, cleaning supplies, and other items that may be specifically requested or offered. So that's another thing that we could be in touch with if you have anything like that. However, what is really the most helpful and most flexible to Northside Housing at this time is financial support. That is why we couldn't interrupt our fundraising. Yes, we had to move away from in-person events and shift to virtual events. We explored different options there. We have offered cooking classes, cocktail hours, comedy nights, arts and crafts workshops. And these have all been offered us a really great and creative way to engage with more individuals at more opportunities. And this is also why we're working so hard on our year-end fundraising as well. Since what we raise now in December will truly help carry us into the new year, and the flexibility of donations will directly impact our programs and services in ways that is far less restrictive than some of our other funding streams. So one example of how we can utilize these funds is our Client Assistance Fund, which we use to help remove low-cost barriers that stand between clients and the various small but significant hurdles to housing that they face, such as apartment application fees, security deposits, fees associated with required documents like requesting their birth certificates, moving costs, higher utility bills in the winter, and other basic needs and expenses that make it difficult for clients with little or no income to be successful in goals to becoming, and just as importantly, remaining stably housed. And especially with concerns and fears around COVID-19, we have clients that need this type of support now more than ever. It does create challenges that can cost money to address. For example, we have clients who fear going out for trips to the grocery store due to their concerns and worries about COVID. Our case managers, however, support them through these concerns with not just education, but they're able to help them by providing extra PPE, which we're able to purchase or have donated. We are able to drop off food from our food pantry, which is also something that comes from the Client Assistance Fund or other donated means. So these are just some of the ways that we can really impact the individuals that we serve. And with these types of cost prohibitive barriers, when these types of cost prohibitive barriers are alleviated, our clients can really focus their attention on their health, their families, and their healing rather than on how to save those last dollars to earn for a security deposit or how they're going to pay their gas bill next month. So community support and engagement really means a lot to us and our services and our clients. So
thank you. I know that we ran through a lot, so.
Great. Well, thank you, Laura and Carrie. That was really great. And I love that you ended on ways people can help out and volunteer and just support the organization, because you're obviously doing a lot. And as we know, 2021, although it's a new year, there's still going to be a lot of challenges that we currently had in this year. So thank you for that. I think we are over, but let's give at least a few of these questions from the live chat. I would love to get a chance to get a few of these answered. So I'm just going to start with one right now. So, what made it so easy to quickly relocate and house the homeless? What made it so easy to quickly relocate and house the homeless that makes it so hard? Is it the cost? Is it the red tape? Seems like the pandemic emergency suddenly made things possible for the city.
Oh, that's a great question. I think that a lot of it came from, CARES funding and funding from the federal government that made more of an incentive to do it. Like I said, some of it is surprising that it wasn't happening before, but if we can capitalize on the current situation and make it more of a positive situation, then we can do that. But really, the funding came from the federal government.
Got it.
Okay. Let me ask the next question. What sort of flexible operating dollars were available to respond to this changing environment? How dependent are you on philanthropy? Sorry, I can't pronounce this.
No, that's all right. I know what you're asking. No, it's a great question. Our normal budget is just under $3 million, and 75% of it comes from government contracts, and that is not flexible at all, I'll be honest. So we are looking at having to raise from the private sector about 25% of our budget, and that's without COVID. COVID hit, and we still kind of get stuck into the same thing. Is if the funding through CARES funding is coming from the government, there are certain things that don't allow us the flexibility to respond in a way that is more meaningful for that kind of general use dollars. So we have seen some of our private foundation partners step up and, give us more in that kind of general sense. And we've been able to bring in more of our community partners to assist with it, but we still have a gap with our shelter. I will just share, we're running an additional $20,000 a month in the shelter alone because we had to staff it up, and we paid incentive pay to individuals who were coming, and that isn't all covered. Mm-hmm. So we were a lean organization to begin with, and then we had to become even leaner.
Mm-hmm. So have there been any noticeable effects from mutual aid groups that began this year? I know there's been various have been able to connect with and provide resources for a number of encampments and individuals.
Yeah, there has. And I think the encampments are one area that people were going out to, and there were the resources associated with that. There were some really kind of impressive partnerships from the philanthropic world that came together and looking at the Chicago Community Trust, was able to really kind of put into action and make funders, really come together. And they did some initiatives out there to really maximize kind of this need to do something, whether it was a smaller donation or a larger, but pulling it together. Northside, we were able to take advantage of some of that, not at the level that I would want, but we were able to capitalize on that. And so it's been nice. And some of the encampment focused agencies were also able to take advantage of that. There are specific healthcare providers that go out to encampments as well, but hopefully what you'll be seeing is more available housing for the individuals if they are interested.
Okay, so I think we're about at 8:04. So I think those are all the questions from the live chat. So at least we got through those. Once again, thank you, Laura, and thank you, Carrie. This was really insightful. I learned a lot, and I know that our viewers did as well. So remind everyone that we will have the post live stream Zoom, so you can find a link in Show Hack Night, and I think it may be shared in the YouTube Q&A chat as well. But if not, it's always going to be on Show Hack Night's website and also on the Show Hack Night Slack channel. Probably on the Slack channel only. I don't know if it's on the website actually. So join us for the post Zoom. And then once again, thank you for our guest speakers. You were great. Any last words, Nico, besides our final last words? Well,
Yes.
without further ado,
Thank you.
And
hack.
Yeah, right, there you go. Better like the number.
Thank you.
All right, thank you, everyone.
Thank you.
Bye.